Hello, I'm Jim Coyle, and this is the first tutorial for social work practice with individuals. I'll be talking about the theoretical basis for social work practice and specific social work perspectives that influence practice. Our textbook author, Walsh, describes social work practice as the application of social work theory and methods to the resolution and prevention of psychosocial problems experienced by individuals, families, and groups. Take a moment to consider what this means. First, social work practice is about theory. There's a theoretical explanation for what's going on. Methods are the things that we actually do to help people. That practice focuses on the psychosocial problems experienced by our clients, and that it could focus on individuals, families, and groups. In this course, we're going to talk specifically about practice focused on individuals. Overall, social work practice is defined as purpose, sanction, values and ethics, knowledge, methods, and skills. What this means is that the purpose of social work practice is related to the social work mission. That is to enhance the well-being and help meet the basic human needs of all people, and particularly to empower those who are vulnerable. Sanction refers to the authority that we have, to the professional responsibility that we have. In Ontario, that refers to the Ontario College of Social Workers and Social Service Workers, or to our professional organization, the Ontario Association of Social Workers. Values and ethics kind of acknowledges that social work has a set of values when working with people that kind of identify what is the important aspects. We highlight the dignity and worth of all people. We highlight social justice, personal integrity, as well as competence. That is that we take responsibility for training and knowing that the methods we're using are actually solid and valid. Knowledge is related to the theoretical basis, and we're going to talk about that in this course, as well as the methods and skills, which is what we do to help, the intervention techniques that we use. These are the real important aspects, the primary aspects, I should say, of this particular course. What is theory? Well, sometimes the word theory, perspective, framework, and model are used as synonyms. Yet the words do come on a sort of continuum, and one end of the continuum is abstract and general, and it gets more concrete and specific at the other end. On the more general aspect, theories often explain how human behavior overall occurs and how human behavior can change. It's an explanation of that. Perspectives suggest interpretations that we use in order to kind of understand that and to recognize what's important in providing meaning for that. Practice frameworks or models focus on the specific methods, and these are the more concrete things that we do when we're trying to help people. There's several theories that we're going to talk about in this course. First of all, the overall social work perspectives, which you've heard about from other courses. The strengths perspective, risk and resilience, diversity and social justice, empowerment, spirituality, and the ecological perspectives. Those are all things that are very important in terms of social workers' way of looking at what's happening with clients. The theoretical aspects of the practice models relate to a number of different ways of understanding human behavior. Humanistic focuses on the interpersonal aspects of relating to people. And the person-centered therapy is one of the models that uses that particular theoretical aspect. Psychodynamic theories focus on the inner mechanisms that explain how we behave. Ego psychology and relational theories use that particular theoretical perspective. Cognitive and behavioral theories. Cognitive talks about how our thinking influences our behavior. Behaviorism refers to how we learn and how behavior is reinforced. So there's cognitive therapy, there's also behavioral therapy, and to a great extent, these two have been joined together in cognitive behavioral therapy. It uses both. Postmodern theories have kind of refuted the belief that there is one way of looking at things. They are really about having people's way of interpreting meaning for their world as affecting how people's reality is defined. Solution-focused and narrative therapies follow this theoretical perspective. We're going to talk about motivational interviewing and crisis intervention frameworks, which are very specific kind of frameworks or models for working with different client problems, and they can be very helpful. Consider the benefits of learning multiple theories. We can use that to be able to talk with our professional colleagues about different things that we may be able to do, or different decisions we'll make in terms of working with clients. We can compare methods for organizing client assessment and intervention and determine which approach will fit with us to a great extent for our personal style, as well as how we can adjust things so it fits better with the client situations and their particular needs. Consider what you know about social work perspectives. As I said, your previous courses have also talked about this, and you may be using particular perspectives in your own workplaces. It's helpful to take a look at how these particular perspectives, what do you know about them? How have they influenced what you do with clients to this point? Consider then how these perspectives are going to influence what you do with clients as you learn different models of working with clients in this course. Also, think about what you already know about practice models. Although this course is going to focus on teaching you about these models, we aren't in a vacuum here. You've been working in the field, and it is helpful to take a look at what you've already learned, what you learned in previous courses, what you have learned at work, what you're already using. So have you used elements of person-centered therapy? How about ego psychology and object relations interventions? Is that something that you're familiar with or not? How about cognitive therapy, behavioral therapy, or cognitive behavioral therapy? This is such a common way of working with people that many of you may already be using elements of this with your clients. How about solution-focused and narrative therapies? Although these are newer models, they have been around for quite a long time, and they've come into the workplace, and sometimes they are very helpful for people working with their clients. Finally, what do you know about motivational interviewing? What do you know about crisis intervention? Have you ever used these particular frameworks? Have they been helpful? Have they not been helpful? What kind of models do you use with clients? Are there other models that you've used that aren't on this list? I encourage you that as you think about these things, that you jot down your ideas. What do you know about the social work perspectives? What do you know about practice models? What are your questions? What do you want to learn more about? Because we're going to talk about this in class, and it will prepare you to discuss this in class and make sure that the class discussion meets what you want to get out of this course. It's important to recognize that social work is both an art and a science. The art aspects relate to our engagement with clients, our ability to form a relationship with our clients, and to collaborate with the clients so that we can help them work on something that's going to fit for them. On the other hand, the science aspect of social work is related to the fact that it's based on theory. There is a theoretical explanation that social work uses to say what they believe, what we believe is explains what happens with human behavior and how change occurs. We look for evidence from research for this as well as for the interventions that we use. We also are challenged to recognize that when we are working with clients and we are prescribing interventions and working with clients in an intervention, we want that intervention to be measurable in some way so that we can test, does the intervention actually help the client accomplish the goal? That puts us on our toes, because it's not just a matter of being friendly and listening and having a good relationship with the client. If we want the presenting problem to be resolved, then we have to do something specifically that we believe is going to resolve that presenting problem. And we want to know, is it working or not? Overall, social work tends to use a problem-solving process when we're working with clients. This focuses on helping the clients resolve a presenting problem, because when clients come in, they're coming in for a reason. The way you do this is, to begin with, is by asking, what is happening? When is it happening? How is it happening? How much? How often? Why? What are the influencing factors, and what are the consequences of what happens? The problem-solving process considers what the clients have done to resolve problems in the past, because maybe this can be useful in helping them resolve this present issue. It also focuses on the client's goals. So it's not so much about the worker saying, well, this is what you need to do. It's about the worker having a conversation with the client about what makes sense for them. What do they want to see happen? Helen Harris Perlman is one of the more notable theorists in social work history, and she discussed this problem-solving method. She encouraged social workers to identify the problem as well as how the person experiences the problem, to examine what influences the problem, to consider possible responses to the problem, and consider the pros to those responses, the cons, which fits best for the client, and have a discussion with the client about this. And finally, as I mentioned before, to assess the effectiveness of the action. Overall, social work practice tends to emphasize a biopsychosocial spiritual assessment. That means that we are looking at the fact that sometimes presenting problems can be influenced by what we've inherited, or our physical being, as well as our psychological aspects, the social aspects with us and people around us, our environment, as well as the spiritual aspect, our belief system, our sense of what is meaning and how we fit in the overall world. One of the things to note is not all of the models that we're going to discuss in this course are going to focus on every one of these aspects, and some models are going to emphasize one of these aspects more than others. And it's helpful to be able to compare and to know, okay, what exactly are we assessing in terms of this? Social work also tends to use a person relationship to environment perspective. That's an ecological perspective that acknowledges that people are influenced by what happens in the community, particularly those people who are experiencing oppression or discrimination. And that's where that social work mission of social justice is really important. There are phases of the problem-solving model that are really helpful for us to learn and use when we're working with any client. And that's engagement, data collection and assessment, planning, contracting, and intervention. That includes goal setting, evaluation, and termination. I've tried to kind of do a flow chart to show how these processes of problem solving come together. On the left-hand side, you can see here that engagement happens throughout the whole process. It's listening, it's empathizing, it's working in a collaborative way with the client. Data collection begins with asking about the client themselves and their presenting problem, and then the history of what has happened in the presenting problem, but also what factors may be going on in their life which are going to influence that. While we're asking those questions, we have a parallel process of assessment that's happening. We are asking ourselves, what do we think is going on? What is the presenting problem about? What influences it? And as we assess that, that will suggest other questions that we want to ask. And so there's a double arrow there. As we get this information, we're going to begin to share our assessment with the client in order to identify what we should be doing in order to work on the presenting problem. As you can see, that this involves then an assessment process between the worker and the client. Do we agree? How do we collaborate in identifying a particular goal that the client think will work for them? And how will we contract who's going to do what and the interventions which may help the client achieve that goal? Then we get into an evaluation process. Are the interventions actually achieving the goal? Is the goal accomplished? And if no, then what else do we do? If yes, then we think about what's called termination, or this is the end of this particular intervention session between you and the client. Consider how the problem-solving model will guide your practice. Review the role-play case scenarios that are in your Blackboard site and think about how you would use this problem-solving method to help those clients. Jot down your ideas about this because we're going to talk about that in class and also give you an opportunity to actually role play this particular model with one of those clients. It's important to note that social workers use the problem-solving method to organize their work with clients, and this fits with every practice model that we're going to talk about in this course. Skipping parts of the problem-solving model can reduce the effectiveness of intervention. So, for example, if you decide that you don't need all that data collection, you may miss information that's going to be able to tell you whether the intervention that's being proposed is going to be the most effective intervention or not. If you skip talking with the client about their goal and what makes sense for them, then the intervention, the client may not be, kind of motivated to do the intervention because they don't see how this is going to really help them accomplish something that's meaningful for them. I encourage you to think about at this point, what have you learned from the reading that was assigned, from this tutorial, as well as from your own experiences and how you pull them all together. Jotting down your ideas about this and any questions you have, particularly about what you need to what you are interested in learning more about, can add to the conversation during class. And I look forward to talking with you in class about this.